Good morning. Welcome, everyone. Thank you so much for joining us. We're very excited to have you here today. We're very excited to be here to celebrate the silver anniversary, the 25th year anniversary of Alabama's Children Health Insurance Program. CHIP, as it's known, or All Kids here in Alabama, is a wonderful program that helps to provide insurance coverage and access to care for Alabama children everywhere. This is a program that provides full medical benefits, including pharmacy and vision and dental and mental health benefits, and access to providers throughout the state using the Blue Cross Blue Shield network. It's a program for low-income families. It's for families that are slightly above the Medicaid income threshold. So these tend to be working families. These tend to be families that may not otherwise have access to care or may not have health insurance through their employment. So this is a wonderful program that we have had now for 25 years. It's done so much good for children in our state. As you'll hear a little bit later today from some of the others who are going to speak, Alabama was the first state to have its plan approved 25 years ago, and truly this has been a fantastic example of how a government program can actually work well. CHIP has been a win-win for Alabama taxpayers, but especially for Alabama children. As a result of the provisions in the Affordable Care Act, CHIP has also extended coverage to a couple of groups in the Medicaid income range through the M-CHIP program. We work very closely with Alabama Medicaid to make sure that families know about this and have access to this. We have a dual eligibility enrollment program so that there's no wrong door for families to go through and they can end up getting the coverage that they want for their kids. We continue to try to make improvements to the program. In the last few years, we've had a pilot program that we call All Babies that reaches low-income moms so that their babies can be covered as early as possible in life so that they don't have to wait at all for coverage. And we hope to be able to expand that to other parts of the state or eventually perhaps to all parts of the state. CHIP continues to provide coverage for children everywhere. It's a wonderful program. It's one that we're very proud of. We're the only state public health agency in the country that runs the CHIP program. It many times resides in other government agencies, but we're very proud to have that part of public health. And you're going to hear today from some of the people who actually made that happen beginning 25 years ago. In just a moment, we're going to hear a video from our governor, Governor Kay Ivey, that we'll broadcast for you. And then we're going to hear from some other speakers. We're going to hear from Dr. Don Williamson, who needs no introduction, but I'll introduce him anyway as president of the Alabama Hospital Association and previously state health officer here at ADPH. We're also going to hear from Gail Sandlin, who was Alabama CHIP director starting in 1998 up through 2007. And then I believe we may hear from Kathy Caldwell, who was the CHIP director starting in 2007 as well. I think we're waiting on her to arrive, so we'll let you know about that. But that's going to be the order of our ceremony today. After this, we're all going to move across the hall for those of us here in person, and we'll have a nice reception there for everyone as well. So at this time, we're going to hear from Governor Kay Ivey.
For the past 25 years, the Children's Health Insurance Program, known as All Kids in Alabama, has opened new doors to quality health care for children. Since its inception, All Kids has insured more than 1.6 million children in Alabama and helped protect their health and well-being by offering an excellent comprehensive health coverage plan. In 1998, Alabama became the first state in the nation to have a federally approved CHIP plan. Prior to the program's initiation, 15% of Alabama's children under the age of 19 were uninsured. According to the 2022 Kids Count data profile, Alabama ranks better in insuring children than the United States as a whole. The data revealed only 3% of Alabama children were without health insurance from 2016 to 2020, compared to 5% nationally. This success would not have been possible without the continued support of the state's elected leaders, healthcare providers, and other advocates. Thank you to all of these special partners. I want to extend my congratulations to Alabama Children's Health Insurance Program on reaching its silver anniversary and for making a positive impact on Alabama families. May God continue to bless each of you and the great state of Alabama.
Well, good morning. Dr. Harris, thanks for the opportunity to participate in this momentous occasion. In 1997, 15% of Alabama's of children in the United States less than 18 years of age were uninsured. And depending on how you look at the data, in Alabama that number was actually, in many cases, closer to 20%. But Alabama was blessed by a set of coincidences that occurred right after President Clinton signed the Child Health Insurance Program legislation. The Alabama legislature tasked the Department of Public Health with implementing the Alabama Child Health Insurance Program. Sometimes in life, it is important to know what is not impossible. Had we known in 1998 how difficult the implementation of an insurance program is, we would have probably tried to find a way to get somebody else to do this. But we didn't understand all the challenges. So we submitted a proposal to HHS. We were the third state in the nation to submit a plan. As you've already heard, we were the first state in the nation to get our child health insurance plan approved. Now, we recognized we did not know how to run an insurance program. So we sought outside help. We built important partnerships. Our first enrollees were was an expansion of Medicaid. So we were absolutely dependent on the Medicaid agency and the partnership there. As we began to move beyond just that initial group and had to do additional enrollments, we had no enrollment system. So we partnered with the State Employees Insurance Board to do our first enrollments. We then, obviously over years, developed our own enrollment systems, but we depended on advisory groups composed of advocates, physicians, legislators, and others to help design the program. The one thing, though, we did know was that we had only one goal, and that goal was to ensure as many eligible children in Alabama as possible, with the fewest barriers, keeping any cost sharing, whether that was premium or co-pays, as minimal as possible. Now, these things don't happen by accident. It takes incredible leadership, both within the agency and without the agency, to make these things happen. And I was blessed to be able to work with extremely committed and dedicated individuals within the department. Gail Sandlin, the first director, Kathy Caldwell, who followed her. My job, while I was health officer with all kids, was to stay out of the way, let them do their job, and just to advocate for funding for the program. But you also don't do this in a vacuum within an agency. We had enormous outside support from the medical community, especially the Academy of Pediatrics, the Academy of Family Physicians, Children's of Alabama, USA Women's and Children, all of them essential providers of health care for children. We had advocacy groups who not only supported our budget request over the years, but who also worked hard to encourage parents to get children enrolled. But I have to be especially appreciative of elected officials, governors who, even in hard times, made sure there was money in the budget for the child health insurance program, and the legislators who always found a way to fund the program. There were years where it was tough, where we didn't have as many dollars as we would like because the state was going through difficult times and we had to freeze enrollment. But the one thing that I can absolutely say is that no one ever raised the idea that we were too poor and that we needed to shut the program down. This was a universally popular program for taking care of our children. So in 2015, now 7 years ago, when I retired from public health, And fortunately, at that point, hundreds of thousands and maybe more children had been covered by All Kids. Our uninsurance rate among children had declined to about 3%. So we had gone from somewhere near 20% to 3%, all because of a single focus, and that was providing insurance to children. So even today, when you look at the measures of child well-being in Alabama, our coverage of children stands out as a shining beacon. I think All Kids is something that all Alabamians can be proud of. People who know me know that I always have a quote for everything. Sometimes they're actually attributed to the right person. Abraham Lincoln is alleged to have said that no man stands taller than when he stoops to help a child. I think All Kids is a shining example of when Alabama stood tallest, when we reached down to help our future, our children. And frankly, now as a grandparent, I understand even more than ever the value that this is for the citizens and our future in Alabama. So in closing, I would just say of all the things that I was involved with in my 30 years in public health and 23 as state health officer, All Kids is one of the things with which I am most grateful to have had a small part. So with that, thank you. Gail, I'll turn it over to you.
Thank you. Help the old woman up. Good morning, good morning, good morning, good morning. What a treat it is for me to be able to be here and to talk about All Kids. As Dr. Williamson said, highlight of his career, it definitely was a highlight of mine. I've been away from the program for 15 years. I don't remember all of the data and the points and how many children, the budgets and those kinds of things. I didn't do a real good job with those when I was here. We had people who took care of the financial end of it. But I wanted to just reflect on a few things that happened in those initial days. Alabama was the first state in the nation to have our plan approved, and it's one of the few times that Alabama did something right and did not have to have a court order in order to make it happen. So many of our social systems in Alabama had to get into court orders in order for the staff to be able to see what needed to be done to make the changes for the legislature to provide the funding. That absolutely was not a necessity with the All Kids program. I didn't have the vision for All Kids, and to be perfectly honest, if it wasn't for Dr. Williamson and his staff assistant, Kathy Vincent, if it were left up to me when I was in here, I was very busy. I had more than I could do. I liked new programs, and I liked starting new programs. But when CHIP came on the forefront, I said, Gail, stay back. You haven't got time. You've got enough on your plate. Well, I was sent to Medicaid to a meeting to talk about CHIP, and I called it CHIP with whatever rhymes with CHIP. I literally went to the meeting with my arms folded. I did not open my notebook. I did not take a note because I thought, I'm too busy. I haven't got time for this. I came back to the department, and Dr. Williamson called key people in the department together. And he and Kathy Vincent said, I don't want any of your other responsibilities to come before working on the Children's Health Insurance Program. And it was at that point a little light bulb went off in my head, and I thought, this is pretty important because their vision I relied on. And I thought, I think I need to open my notebook and take some notes. I need to look at the regs. I need to figure out what this CHIP is. And so I did, and it was one of the best things that ever happened in the state. We chose, as Dr. Williamson said, to bring folk together because the regulations were not out, and there were a few people who said, we have to wait for the regulations. Not Dr. Williamson and Kathy. They said, no, we're going to figure this out and move ahead and put the program in place. We brought probably about 150 people on a task force. It was wide open. If you have an interest in children's health care, come to these meetings. Help us think through how we need to build this program. I can't list all those people because many of them are not forefront in my mind after 15 years, but anybody who had an interest in advocacy groups, state agencies, associations came to the table, actively working week after week after week on figuring out how we were going to craft this program and put it together. And indeed we did. We did not have the eligibility system in place, as Dr. Williamson said. SEIB came to our rescue. We were soon able to put it in place and to do that. We were committed to make sure that children would either get into Medicaid, All Kids, or the Child Caring Foundation operated by Blue Cross Blue Shield. And eventually, we put together a joint application. Initially, it was a paper application, and then we pushed for it to become an electronic application. But when it was a paper application, I used to say we had the tote system. We put them in a box and toted them up to Medicaid when they were Medicaid eligible. And we found lots of children who were Medicaid eligible, who then were referred to the Medicaid program, and they were put on the program that's there. That's just a small example of how the program mushroomed and how children were able to get health care and to be able to go to physicians' offices, to get treatments, to get preventive care. And when they had a health problem that needed to be done and they needed to go to the hospital, all they had to do was say, yes, I have my card. I'm on my way to the hospital to get the care that my child needs. We also set up eligibility by declaration, which was a monumental feat. We decided, and after thorough research, that the volume of people who might falsify information in order to get on the program was minute, and we tested that, and that's exactly what we found out. So folk needed to declare their income, declare their situation, and based on that, we either referred them to Medicaid, put them on All Kids, or sent them to the Child Caring Foundation if their income was above that. Because we took those steps, because we were so involved with so many people throughout the state, advocacy, state agencies, in ways that we had never worked together, All Kids was recognized on the national level as an expert, and we were called to go to meetings to explain what we had done, to speak in congressional hearings, to explain what our efforts were, what our desires were, where we wanted the program to go. I stand here today to represent all of those 150 people and the staff and the dedication that folk had, and to celebrate the vision that Dr. Williamson and Kathy had to help us say, yes, we can, and to move forward. And to think after 25 years, they're still doing it. And that's wonderful, and I'm sorry. I get emotional in my old age that the impact for children in the state, and as Dr. Williamson said, having grandchildren now, I see the value of the healthcare system, and to know that 1.6 million children have been helped and able to get health care is a phenomenal experience. Thank you. Didn't expect to do that. Thank you.
Good morning. So, as already stated by Dr. Williamson and Gail, we are here today to celebrate the hundreds of thousands of children who have spent time enrolled in All Kids. These are children who would have otherwise been uninsured. So it is, as others have already pointed out, from day one, it was a collaborative process. We were encouraged by the federal government to set up a program that was family friendly, to break down barriers to coverage for children. Just an incredible group of individuals made this happen. Certainly Dr. Williamson, Gail Sandlin, Kathy Vincent. When Dr. Harris came on with the department, he was in full support of everything that we had going on in All Kids. The many staff, Tila, Wanda, Tara, are among a few here in the room. But it just from day one, the passion and the commitment to making this an incredible program. As Gail said, All Kids is a shining light in this country. It has worked well, served many families, and a model for other states. So I really wanted to, focus on all of the passion, all of the energy from so many entities around our state and nationally that made this happen. And I've already mentioned several of them, but including is the governor's office. Dave White has been involved with All Kids for many years. The state legislators, members of Congress. Not too many years ago, we had a vicious battle for CHIP reauthorization. Everybody knew that CHIP would be reauthorized. It was just that Congress had not taken action. Christmas was coming. Congress was soon to go home for the holidays. And many people in this room remember it. And Keith, I didn't mention you, but you were a huge part of this. We had 80,000 letters already printed that were going in the mail on December 26th. Because we were running out of federal funds, we had to give notice to these families that their All Kids coverage would end. I remember, I believe it was December 21st, I had taken the afternoon off because it had been so insane. I hadn't done any Christmas shopping. I got a call from a congressional staffer saying, if we allocate X amount of money, will that keep Alabama from putting those letters in the mail? And I said, yes, but that only buys us 30 days. So it was that kind of touch and go. But the support, both with the stakeholders here in Alabama, our members of Congress, as I said, our legislators, it was a battle. And it was because all of these individuals knew the value of All Kids and, really put everything on the line for it. Included in that list of folks I want to thank the Medicaid commissioners who have been involved. Hopefully I'll see Stephanie Azar today, but multiple Medicaid commissioners. Dr. Williamson's huge role in Medicaid for a number of years. Mental health, rehabilitation services. This is a true partnership and has been from day one. And, like Gail was talking about, Gail and Kathy and Dr. Williamson making that happen. So a true success story. It was laid out to me from day one. Every policy decision is to be family friendly. Our goal was to get every child in this state insured. And as Gail said, we had numbers, we had good information that showed that it made a difference to reduce those barriers and really have a mindset of doing everything in our power to get the children insured as opposed to putting up barriers to enrollment. So personally, I was a 40-year-old intern when I came to work for Gail Sandlin. And, I knew these values from day one. But also, Gail took me along everywhere she went. And exposed me. And, Kathy and Dr. Williamson as well exposed me to the bigger picture. I will be forever grateful for that, to being able to see the big picture. Gail and Kathy used to always talk about presenting things from a positive perspective. And I mean, these are lessons that I use every single day. Gail mentioned numbers. We were such a great team that when Gail retired, I mean, I had plenty of anxiety because Gail was the one that loved to do this type thing. I knew the numbers, and Dr. Williamson actually knew the numbers better than I did, but I knew the numbers. And Gail would be speaking to large national audiences, and when she got to a number, and I sort of waited for her to do it a little while ago, when she would get to a number, she would pause, and I would shout it out from wherever I was. And so so there was plenty of anxiety, when she was gone. It was like half of the team's retiring. But anyway, so I just wanted, on a personal level, I wanted to say thank you. Thank you to the state leadership, to the ADPH leadership, and like I said, Dr. Harris has been incredible. I cannot even imagine what all he's been through the last few years in leading this state from a public health perspective. So thank you. But I also want to say thank you on behalf of all the families in our state who have been touched by all kids. One quick story, and to me this so articulates what it's all about. When I was in line at the University of West Alabama getting our youngest child enrolled in college, I think we were in line in the bookstore. And I don't know if I had on an all-kids shirt or an all-kids bag. Who knows? Maybe, I don't know. Something brought all kids up. And the woman behind me said, "Oh, my goodness, all kids is so wonderful." And I said, "Well, I'm the director of all kids." I was really proud, which I am really proud. But she said, "All kids changed our lives." She said, "I always worked a low-paying job to keep health insurance for my family." She said, "All kids allowed me to go back to school and get my degree." And she said, "I'm now a teacher in the public school system. My family is insured with PHIP. But all kids was the piece of the puzzle that without it, I never would have been able to move forward." And to me, that's what it's all about, just helping families when they need it to help enable them to move forward. So thank you to everyone.
Thank you very much. What a great day. And we're not even done. We're going to go across the hall and celebrate some more. It's really been wonderful to hear from each one of these people, to hear these great stories. This is such a wonderful program that's made a difference in the lives of so many people. I would certainly be remiss not to recognize Tila Sanders, who's the next director, who is also now retired as well. But we have such great continuity in this program. We have people from the beginning all the way up to now, and what has really happened in the past 25 years is that lives really have been changed, and so we're very proud to celebrate that again. Thanks again for joining us. We appreciate you being part of our celebration today, and for those of you here, we're going to move down the hall. Thank you very much.